As dental practice becomes more complex, the difference between success and hardship may be the quality of the systems we implement in practice. One colleague who's thought long and hard about systems thinking as applied to dental practice is Dr. Jonathan Mahn from Paris, Ontario. I wanted to find out from him how the COVID pandemic has affected systems thinking in his operation. But first, I wanted to find out what sort of a practice he runs.
Well, we are over 40-year-old practice now, so second generation, and as a result, we have large numbers. We're a larger practice in a small town. We run in the new world, post-COVID, in a series of pods, so small, patient-centered, focused pods, which would consist of a leader who's a treatment coordinator and patient care coordinator, dentist, couple hygienists, assistant, and support.
Have you got one location or more? And how many staff in all do you have?
We do have one single location. It's in a larger building. And it would be hard to get an actual track of full-time staff right now since hours continue to shift in this world. We have well over 50 staff, and the roles vary, like I say, in terms of part-time, casual part-time, and full-time, but the majority are full-time.
Just your brother has an MBA and you're a dentist and you sort of jointly run the practice, is that correct?
My brother is not an MBA. Whether you call it School of Hard Knocks or his previous life as a recruiter, it's a kind of a combination of both. We would complement each other in our skills and our deficiencies. Some interesting dinner table conversations with family, as well as that struggle for who's right in some cases, but it does allow us to have good opportunity to see things through a different lens. But that would be his role.
In talking to you and your brother, I know that you have systems thinking basically embedded in everything you do. But COVID has tested a number of your systems and you've had to rethink them. And today we're going to talk about an issue that arose with your safety system. We'll call it that, patient and team safety. What's the problem that presented itself?
The biggest challenge through COVID with regards to safety being the word of the day and of the year, if there wasn't another, rapid change in terms of what safety means has been one of the most difficult moving targets to hit for all of us in our profession, not knowing which target to hit in some cases. But rapid change means rapid response. And when the response is a series of processes or requirements with safety, you got to keep up. And when that changes overnight and you have a larger team, even in a smaller team, you can't always be watching. And so each process is subject to variability. Personally, I'd call it process decay. As a dentist, we wear many hats. And as leaders, owners, we have multiple roles. So you can't always be watching. So from a safety standpoint, the challenge that presented itself was consistency in terms of safety standards, what we do, how we do it. And when that changes, consistency with the resulting change.
And I can only imagine that there was grounds for confusion with the regulatory body, with public health coming out with guidance, and you're hearing about changes in other provinces as well. How did you identify the particular problem that kept you awake at night around your safety system?
Well, the first was the question of we need to implement new standards, new processes, screening, for example. And knowing that it had to be executed every shift by every person every day, differently in different roles, let's say hygiene to your front desk or your admin staff. The problem became quickly apparent when you try to implement a change and then make a shift overnight. So maintaining the standards and keeping your team motivated to meet those standards was the issue that needed to be resolved. And trying to have consistency in that, it came to light very quickly, as many of us know. How do you get this message out? And how do you make it clear? And how do you make sure that it's happening?
Can you touch on one or more examples of types of warts that appeared that you said, well, I have to do something about this?
Screening and the changes to screening was the first one, right? The first questions were, do you have a cough? Because we didn't know what questions to ask. So these changes came quickly to, oh, do you have somebody with symptoms? Are you an essential worker, or have you been out of country? Even as of the last week in Ontario, any of your family members who may have symptoms mean that your whole family has to isolate, so you can no longer come to work. The screening in those examples would be rapid changes happening on a moment's notice that you have to respond to immediately from a safety standpoint.
What did you do to install a new type of systems thinking around safety?
The concept of an audit is what comes to mind and the basis of our system. This is based on kind of a manufacturing influence or inspiration. And the idea is where we have a checklist, the concept is the checklist will have certain items. Those items are subject to change. When you're working on the front line, if you're the person that's responsible for the checklist, we have to follow that checklist. Now, to make sure that the checklist is happening, the audit can be performed. So the audit list is a series of questions or a subsequent checklist that verifies that the actual processes are working the way they should. So in this particular case, the safety audit that we performed started with the checklist for the people on the floor. Then their supervisor would have an audit checklist. That person's supervisor or our manager would have another audit checklist, the same one. Then myself would have another audit checklist. Those checklists were all the same from an audit standpoint. Now, what are we auditing? We're auditing those areas of significant variability or significant risk. For example, screening questions. Are they all being asked? Temperature checks. Are they being taken and documented? Now, when we walk in and randomly do an audit and assess what's happening, we want to be sure that what we think is happening is actually happening. So we test in layers or check in layers from a leadership standpoint at every tier. When you randomly go in, we should see that what we believe is happening is actually happening and identify gaps.
So you must have some sort of a random system or a sampling system.
That's right. We do have, in essence, once the audit is scheduled to be performed, we actually have a form using Microsoft Forms with the same questions. And each tier of leadership will randomly have a time or a date where they would hit the checklist and answer the questions, verify whether things are being done right or if there's a gap. The gap would be escalated for change thereafter. So the frequency of the audit would vary according to where you are in the tier of leadership. So the first supervisor would do a daily audit randomly, but they have to get it done during the day so that we know it's happening. That verification would then be done by the manager. They might do that once a week and make sure that when they randomly audit in that week, that things were executed according to schedule or process. Then I would walk in and I could do one and say, are they working or are they not? If we identify areas of gaps or consistent concerns, let's say somebody is not wearing a face shield when they should, for example, an assistant or a dentist even, then we might do a less random audit and a more focused audit to say, hey, let's make sure this is working well.
Well, has it worked for you? How have things been going?
It's worked very well. It was initially maybe hard to grasp, as you can imagine with any layered system, but it rapidly identified where we had need for further evaluation or problem-solving opportunities. And this allowed the team themselves to create solutions for making things right. So that way, myself or our manager didn't have to go to the front line and say, we got to fix this, do this, this, and this. They would actually raise the issue themselves because the supervisor was able to ask the person on the front line to say, hey, what's happening, what's the challenges you're having. And they were able to solve that relatively quickly. So it has worked quite well. It's been very consistent. And now the frequency of audits can diminish over time.
It strikes me that we're really talking about systems thinking here. And there's some key principles on which your approach to systems thinking is built. What are those key principles?
The first one is maintain the standards. When I see complexity, the idea is to make it easy for people to do the right thing and assume nothing. And often we're quick to blame, but I'm trying to learn to be slow to blame and quick to understand. Keeping your team motivated to create change is a second principle. So we have different human motivations, both intrinsic and extrinsic. But when we look at those intrinsic motivations, we have problem solving as an opportunity here. We have ownership as an opportunity. And these intrinsic motivations are very key to the success and joy of creating on the front line, even if it is just a safety standard. The last principle I'd say would be trust but verify in terms of an approach. So we trust our team. I'm not going to assume they're doing things incorrectly or intentionally, but I have to verify the system and at every level be able to identify opportunities for change. But the ownership aspect is wonderful for people to have because it now is something that they're part of and that they can create the change that is needed.
So did you dream up this concept yourself, or did you get inspiration from some resource or set of resources?
Our practice is focused on a concept called continuous improvement. Some may know it as lean thinking, but my brother and I have been deeply involved in the CI or continuous improvement world for a number of years now, having, executive coaching and also touring as part of a group of different facilities. Almost all of them are manufacturing, some are in healthcare, but the concepts that we draw upon would be primarily from a manufacturing floor. Toyota, for example, we do processes just like they do. We want our team to have ownership of the challenges and the successes, just like they do. We want to celebrate the wins together as well. But the idea of the audit system is something called a layered process audit, and this is common to manufacturing as a way of continuing and holding or sustaining standards.
Have you any final word of advice about what you've learned about systems thinking in this particularly challenging time?
I think, like anything, you do need a cycle of evaluation, if I would say. Regardless of the system, every system has to have a cycle process of planning, doing, checking, and adjusting. And this would be iterative in terms of the approach. So the system is fundamental to sustaining standards that you want to hold consistent, but it can't be done by implementing a system and hoping that it works. And I think often as a dentist, the challenge is with one of many hats, the system is done and it's go and we forget about it. But to plan, to do, to check and adjust, the check and adjust is the key to those systems. And something that is very difficult for us, for me especially, it has to be scheduled in because we have so many elements in our life that can sometimes create chaos and obfuscate kind of the clarity that we require on a day-to-day basis.
Dr. John Mahn, it's always a pleasure to talk with you.
Pleasure's all mine, and I really appreciate the opportunity.